Smith. My name is Kristina Miles. I'm going to be your nurse practitioner today. I'm going to be also performing a comprehensive physical exam. So is it okay if we begin?
Yes.
Okay. So I'm going to start off by inspecting your face and your head. And it's okay if I touch your scalp. Feeling for any lumps. I'm looking at your hair distribution. I'm looking at your face. I'm checking for any symmetry or lesions or scars, and you look great. Now I'm going to go into your cranial nerves. So would you please raise your eyebrows for me? Can you frown? Can you close your eyes tight? Can you smile with your teeth showing? And can you puff out your cheeks? Very good. Now I'm going to check your sensation. So I'm gonna ask you to close your eyes. And just tell me where you feel me touching.
Feel. Cheek. Chin.
Very, very good. Now I'm going to, one thing I just wanted to assess your temporal pulse as well, okay? I just want to feel here. Very good. Now I'm going to assess your eyes. Let me see your eye. And I'm gonna also ask you to clench that bite down. Very good. Do you feel any clicking or popping?
No.
Okay, so your TMJ is good. Now I'm gonna look at your eyes. I'm checking for symmetry. I'm looking at your sclera, your pupils, your lashes, and yeah, it looks great. Can you look up for me? I'm gonna check your conjunctiva. Perfect. I'm going to dim the lights. And now I'm gonna ask you to focus on the wall behind me while I take a look at your eyes, okay? I'm gonna check your pupil reaction. Very good. Okay, great job. So I'm now gonna inspect the internal structures of your eye, okay? So just focus on the wall behind me and I will take a look. I'm checking for your vessels. I'm looking at your vessels, your macula, disc, and cup. Great job. And I'm gonna look at the other eye. I'm also checking your red light reflex. Very good, very good. Okay, and now I'm gonna look at, check your ears. So I'm checking for symmetry. Everything looks good. Now I'm going to check the external structures. Let me just turn the light on real quick. I'm gonna check the external structures of the ear, but I'm gonna pull the ear out, back, and up. Right now, I'm looking at your tympanic membrane, making sure everything looks good. And it does. I'm gonna do the same thing to the other ear, okay? Out, back, up. Very good. All right. Okay, so now that I'm gonna also do a quick test. It's called a whisper test. So just repeat what you hear me say.
Cat. Dog. Bird.
Very good. You're gonna do the same thing to the other ear.
Cat. Dog. Bird.
Very good. Okay, so now we're gonna move on to the nose. I'm checking for symmetry or any deviation, and everything looks good. So now we're gonna move on to the internal structures of the nose. But before we do that, would you mind, I'm gonna do a quick sniff test, okay? Can you inhale? Very good. Awesome. All right, I'm gonna look inside your nose. I'm looking at the mucosa and your turbinates. Very good. All right, now I'm looking at your mouth. I'm assessing for any symmetry and everything looks good. Would you mind opening your mouth for me, please? I'm gonna shine a light there, and I'm gonna take out a tongue depressor to assess the back of your throat as well. All right. I'm looking at, smile. Okay, with your tongue in first. I'm looking at your teeth, your gums, your buccal mucosa, soft and hard palate. Everything looks good. And can you lift your tongue up for me? Looking under there, making sure everything looks normal. And can you say All right. And yeah, check for your gag reflex as well, okay? So now we're gonna move on to your lymph nodes. So I'm gonna start off with your pre-auricular, and then your post-auricular, your occipital, and I'm gonna go down the posterior cervical chain. I'm going to check your submandibular, submental, and then I'm gonna go down the anterior cervical chain, and then I'm gonna check your supraclavicular. And would you mind shrugging your shoulders for me, please? Very good. And I'm looking at your neck. Let me take a look. I'm checking for any masses, any lesions, and I'm also checking for any goiters. I'm gonna palpate to see if I feel anything. Everything feels good. All right, so we're gonna do a quick test, okay? I'm gonna ask you to take a sip of this water, but hold it in your mouth. I'm gonna sit behind you. I'll tell you when to swallow, okay? All right. I'm checking here. Can you lean to the right? And lean your head forward. All right, can you swallow now? Very good. And one more time for the other side. All right, lean to the side, forward. Go ahead. Very good. Okay, so that concludes the lymph node assessment. Just make sure this is recording. Okay, good. Yes. Okay, so now I'm gonna go into the next system, which is your respiratory system, okay? So I'm gonna start off by inspecting your AP diameter. And it's 2:1, which is normal. Now I'm going to percuss. So I'm gonna percuss. And I'm gonna do the same thing to the back, okay? Okay. Now I'm going to auscultate. Let's take a quick listen. And I'm gonna ask you to take a deep breath every time you feel me move the stethoscope, okay? Inhale. Mm-hmm. Okay, I'm gonna check the back, same thing for the back, okay? Okay, very good. Now, I'm also gonna do your cardiac assessment now. So I'm going to first palpate your carotid artery. Do it one at a time. Very good. Now I'm also gonna listen to them, okay? Very good. I'm gonna ask you to lean forward. I'm checking for heaves. Okay. Very good. Didn't see anything. So now I'm going to auscultate your heart. Okay. You could breathe normally for this one. Very good. I'm gonna ask you to lay down flat. Oh yes, before I'm gonna check your heart with the other side of the stethoscope. Very good. I'm gonna ask you to lay down. Yep. I'm gonna listen to your heart in the same order, okay? And now I'm gonna do the same thing with the small side of the stethoscope, okay? Very good. Now for the last section, we're gonna check your abdominal region. So I'm gonna lift the shirt up a bit, and first I'm gonna inspect. I'm checking for any pulsations, any asymmetry or lumps or masses. And now I'm going to percuss. Oh, actually, before I percuss, I'm gonna listen to your stomach. Make sure you have bowel sounds. All four quadrants. Very good. You sound normal. Now I'm gonna percuss now. Okay. Now I'm gonna percuss your liver border. Okay. This sounds normal. I'm gonna now palpate. Okay. Let me know if you have any pain. Take a deep breath. Okay. Very good. No pain or discomfort, right? Okay. You can release now. I'm gonna palpate the rest of your stomach. Feels normal, okay? And that's it. Thank you so much.
Thank you.
All right, you need help?